Your baby is talking to you right now. Not with words, but with a secret language that most parents miss completely. Every gesture, every cry, every tiny movement is a message. And when you learn to read these signals, everything changes. You stop guessing. You reduce frustration for both of you, and you build a connection so deep that your baby feels truly understood. In this video, I'll decode the hidden communication system your baby is using every single day, reveal the secret signals they're sending before they can say a single word, and show you how to respond in ways that strengthen their brain development and emotional security. If you're ready to finally understand what your baby is telling you, stay with me until the end. Before we dive in, hit that like button, subscribe to Little Nest Guide, and ring the bell so you never miss these crucial parenting insights. Let's unlock your baby's secret language together. Long before your baby says mama or dada, they're communicating constantly through a sophisticated system of signals. The problem? Most parents don't know what to look for, so they miss the messages entirely. Let's break down the 4 most critical signals your baby uses and what they actually mean. The hunger signals you're missing. Your baby doesn't wait until they're screaming to tell you they're hungry. In fact, crying is actually a late hunger cue, a sign you've missed the earlier, quieter messages. Watch for these early signals. Rooting, when your baby turns their head toward anything that touches their cheek, mouth opening and closing. Tongue movements like licking or sucking motions, bringing hands to mouth repeatedly, and increased alertness with searching movements. When you catch these early cues and respond quickly, you reduce stress hormones in your baby's system. You're teaching their brain that their needs will be met promptly and predictably. Over time, this builds trust and security, the foundation for healthy emotional development. Pain signals. When something is actually wrong. Pain communication is different, more urgent, more intense. A pain cry typically starts suddenly, is high-pitched and continuous, with barely any pauses for breath. Your baby's body language changes too. Fists clenched tightly, legs pulled up toward the belly, back arching, facial expressions with furrowed brows and wide-open mouth, body stiffening or becoming rigid. Here's what many parents don't realize. Babies communicate pain differently depending on the source. Gas pain shows as squirming, leg pulling, and intermittent crying. Ear pain often comes with head shaking, ear pulling, and crying that worsens when lying down. Reflux pain includes back arching during or after feeds, crying while eating, and discomfort when flat. Never ignore persistent pain signals. Trust your instincts. If something feels wrong, consult your pediatrician immediately. Your baby is counting on you to decode these urgent messages. Tiredness cues. The window you can't afford to miss. Overtired babies are miserable babies, and the reason is biological. When you miss the sleep window, cortisol spikes, making it harder for your baby to fall asleep and stay asleep. This disrupts brain development and emotional regulation. Early tiredness signals include decreased activity, quieter demeanor, less engagement with toys or faces, glazed or unfocused staring, yawning, obviously, ear pulling or hair tugging, and turning away from stimulation. If you miss these, you'll see the late signs: fussiness and whining, rubbing eyes or face, arching back, jerky arm and leg movements, crying that's hard to soothe. The key is to respond to early signs immediately. When your baby shows that first yawn or starts tugging their ear, begin your sleep routine right away. You're working with their biology, not against it, and the result is better sleep for everyone. Overstimulation. When everything becomes too much. Babies have a limited capacity for sensory input. Too much noise, too many faces, too much light, and their nervous system hits overload. Overstimulation signals include gaze aversion, turning head away from you or stimulation, hiccuping, sneezing, or yawning repeatedly even when not tired, fussiness despite being fed and rested, color changes, becoming pale or flushed, frantic or jerky movements, and hand-to-face gestures like covering eyes or ears. When you spot overstimulation, Act immediately. Move to a quiet, dimmer space. Reduce noise and visual stimulation. Offer gentle, rhythmic soothing like swaying or soft shushing. Sometimes the best thing you can do is simply hold them close and let them decompress in peace. Respecting these signals teaches your baby that you understand their limits, building a sense of safety and attunement that shapes their emotional intelligence for life. Not all cries are created equal. Research shows that babies have distinct cry patterns for different needs, and experienced parents and caregivers can often distinguish between them within seconds. Let's break down the cry code so you can respond more effectively. The hunger cry, rhythmic and demanding. The hunger cry typically follows a pattern. Cry, pause, cry, pause. It's rhythmic, repetitive, and persistent. It starts out shorter and lower in intensity, then builds if ignored. Your baby may also be rooting, sucking on hands, or becoming increasingly agitated. The pitch is mid-range, not the high-pitched shriek of pain. When you hear this pattern, especially if it's been 2 to 3 hours since the last feed, hunger is the likely culprit. Respond promptly to keep stress hormones low and reinforce that you hear them. The pain cry, sudden and piercing. Pain cries are unmistakable once you know what to listen for. They start suddenly, without warning, often with a long initial wail followed by breath holding, then repeated high-pitched, continuous cries with minimal pauses. There's an urgency, almost a panic quality to the sound. Body language confirms it: tension, arching, pulling legs up, clenched fists. If you hear a pain cry, check immediately for obvious causes: clothing tags rubbing skin, diaper rash, a strand of hair wrapped around a finger or toe, gas bubbles, or signs of illness. Pain cries demand immediate investigation and response. Never dismiss them as manipulation. Babies don't have the cognitive capacity to manipulate. They're communicating genuine distress. The tired cry, whiny and escalating. The tired cry often starts as fussing and whining, then escalates into full crying if sleep doesn't come quickly. It sounds whiny, almost nasal, with an on and off pattern. Your baby might rub their face, yawn, or show the tiredness cues we discussed earlier. The cry intensifies as overtiredness sets in. If you catch the early fussing and start the sleep routine immediately, you can often avoid the full meltdown. But once overtiredness hits, the cry becomes harder to soothe because cortisol is flooding their system. This is why watching for early tiredness signals is so crucial, preventing the tired cry before it starts. The overstimulation cry, distressed and frantic. This cry has a frantic, overwhelmed quality. It might be accompanied by gaze aversion, jerky movements, and difficulty being soothed by normal methods. Your baby seems distressed, but not from an obvious physical cause. The environment is usually the trigger: too much noise, too many people, too much activity. The solution is removing stimulation: dim lights, quiet space, gentle holding without bouncing or talking, just calm, quiet presence. Once their nervous system settles, the crying usually stops quickly. Over time, you'll learn your baby's sensory limits and can prevent overstimulation before it escalates. Teaching baby sign language, the communication breakthrough. Here's something powerful. You don't have to wait for speech to communicate with your baby. Baby sign language gives you a shared vocabulary months before verbal language develops, and the research is clear. It reduces frustration, accelerates language development, and strengthens your bond. Why baby sign language works. Between 6 and 12 months, babies have the motor skills to make simple hand gestures, but they don't yet have the vocal control for speech. This creates a frustration gap. They know what they want but can't tell you. Baby sign language bridges that gap. When your baby can sign milk, more, all done, or hurt, they feel heard and understood. Tantrums decrease. Confidence increases. And contrary to old myths, signing doesn't delay speech. It actually accelerates it. Studies show signing babies often speak earlier, and with larger vocabularies because signing reinforces language concepts and encourages communication. How to start teaching baby signs. Begin around 6 months, or whenever your baby shows interest in imitating gestures. Start with 3 to 5 essential signs: milk or nursing, more, all done, eat, and help. Use the sign every single time you say the word. Make it part of your routine. Do you want milk? While signing milk. All done while signing all done. Be consistent, patient, and repetitive. It may take weeks before your baby signs back, but they're learning, watching, and absorbing. One day, often around 8 to 10 months, they'll suddenly sign back, and you'll experience a communication breakthrough. From there, add more signs gradually. Words for favorite foods, animals, feelings like hurt or tired, and common requests. Keep it simple, functional, and fun. The real magic of baby sign language. Beyond reducing frustration, signing creates mutual respect in communication. You're telling your baby, "Your thoughts matter, I want to hear you." You're giving them agency, a voice before they have words. This builds self-esteem and emotional intelligence. Plus, the practice strengthens fine motor skills, memory, and symbolic thinking, all critical for cognitive development. If you want to reduce guessing, minimize meltdowns, and connect more deeply with your baby sign language is one of the most powerful tools you'll ever use. Eye contact, gestures, and pointing. What's normal and what's concerning? As your baby grows, their nonverbal communication becomes more sophisticated. Understanding what's typical and what might warrant professional evaluation helps you support their development appropriately. Eye contact, the foundation of connection. Newborns make brief eye contact, but by 2 to 3 months your baby should be making longer, more engaged eye contact during interactions, especially during feeding, play, and talking. By 6 months they should follow your gaze, looking where you look. By 9 months they should initiate eye contact regularly and use it to share experiences, looking at you, then at an object, then back at you, creating a triangle of joint attention. What's concerning? Consistently avoiding eye contact, not following your gaze by 9 months, or seeming uninterested in faces. These can be early markers of developmental or social communication challenges. If you notice persistent avoidance or lack of social eye contact, consult your pediatrician or a developmental specialist. Gestures and pointing, milestones that matter. Around 9 months, babies start using intentional gestures, waving bye-bye, clapping, reaching up to be held by 12 months. Pointing emerges, one of the most significant communication milestones. Pointing shows your baby understands that you have a separate mind, and they can direct your attention. They point to show you something interesting, a bird, a toy, or to request something they want. This is called declarative pointing and imperative pointing, both critical for social and language development. By 15 to 18 months, pointing should be frequent and accompanied by eye contact and vocalizations. What's concerning? No pointing by 16 months, no gestures like waving or clapping by 12 months, or lack of attempting to share interest or direct your attention. These are red flags that warrant developmental screening. Early intervention makes a profound difference, so never hesitate to seek evaluation if something feels off. Reading your baby's body language for stress and fear. Babies also communicate stress, fear, and attachment needs through body language. Clinging, refusing to be put down, freezing when approached by strangers, or crying when you leave the room are all normal attachment behaviors, especially between 6 and 18 months. This is separation anxiety, a healthy developmental phase showing your baby has formed a secure attachment to you. What's not typical? Extreme, prolonged distress that doesn't respond to soothing, complete lack of stranger wariness, which can indicate attachment issues, or physical withdrawal from caregivers. Stress signals include back-arching, turning away, pushing away, increased fussiness, and changes in eating or sleeping. If your baby seems chronically stressed, anxious, or fearful, consider environmental factors. Are routines chaotic? Is there tension in the home? Are they overwhelmed by childcare or frequent changes? Babies are incredibly sensitive to emotional climate. Creating a calm, predictable, emotionally safe environment supports their ability to regulate stress and feel secure. The way you respond to your baby's communication shapes their brain's emotional wiring. When you consistently read their signals and respond with warmth and attunement, you're building secure attachment, the foundation for emotional health throughout life. The serve and return dance. Every time your baby communicates, they're serving the ball to you. Your response is the return. Coo, you coo back, babble, you babble back. Cry, you soothe. Point, you follow their gesture and label what they see. This back and forth serve and return builds millions of neural connections in the brain's architecture babies, whose signals are consistently acknowledged and responded to develop strong communication skills, emotional regulation, and resilience. Those whose signals are frequently ignored or dismissed struggle more with language, social skills, and emotional health. Attunement, the secret to secure attachment. Attunement means being emotionally present and responsive. It's noticing your baby's signals, interpreting them accurately, and responding in a way that meets their need. You don't have to be perfect. In fact, good enough parenting, being attuned most of the time, is sufficient for secure attachment. What matters is the overall pattern. Do they trust you'll respond? Do they feel safe expressing needs? Attunement creates a secure base from which your baby can explore the world confidently, knowing you're there when needed. When you miss the signal, repair matters. You will miss signals sometimes. Every parent does. What matters is repair. If you realize you missed a hunger cue or didn't recognize overstimulation soon enough, it's okay. Acknowledge it, even if your baby can't understand your words yet. I'm sorry I didn't see you were tired. Let's rest now. Repair teaches your baby that relationships can withstand mistakes and ruptures can be mended, a critical lesson for emotional resilience. Your baby is speaking a rich, complex language every single day. Now you have the tools to understand it. Watch for hunger, pain, tiredness, and overstimulation signals. Decode the different cry types. Use baby sign language to bridge the communication gap. Monitor eye contact, gestures, and pointing for developmental appropriateness. Respond to attachment and stress signals with warmth and attunement. When you master this hidden language, everything shifts. Frustration decreases. Connection deepens. Your baby feels seen, heard, and understood, and that foundation of trust shapes their emotional and cognitive development for life. So here's my question for you. Which communication signal do you struggle to read most? Hunger, tiredness, overstimulation, or something else? And which strategy are you most excited to try? Baby sign language, cry decoding, or watching for early cues? Share in the comments. Your insights and experiences help other parents who are on this same journey. Thank you for watching and for being the kind of parent who invests in truly understanding your child. If this video gave you even one breakthrough, please like, subscribe to Little Nest Guide, and share it with other parents who want to connect more deeply with their babies. Remember, this content is educational only and is not a substitute for professional medical advice. If you have concerns about your baby's communication, development, or health, always consult a pediatrician or child development specialist. May you and your baby speak the same language of love, trust, and understanding. See you soon on Little Nest Guide.